change channels a little bit. But the process is the same. We love and value our volunteers. Some of my absolute best memories was when I was a volunteer before I became a nurse. That's how I found out about community hospice. Was I was a volunteer while in nursing school because they said, "Oh, you're not busy enough. We need you to volunteer someplace." And my educator in college handed me a card for community hospice. So I was able to become a volunteer, and that's where the seed was planted that, oh, this is where I've got to be because it's beautiful. So what you guys do is absolutely beautiful, and I'll quit running my mouth. Again, my name is Tambra, and this is Mackenzie.
Hi, I'm Mackenzie. I work in our Peds care department at Community Hospice, so I've had the pleasure of working with a lot of volunteers during our events. And I get to do the orientation for Peds care now with volunteers if you're volunteering with our department. So just a little bit about me, I'm a social worker. I've been a social worker for about 7 years. And my background is I work with children and family doing mental health services before I came to Peds care. But this is my love is working with children and family with medical complexities. So hoping that what we can bring to you is a little bit of information about how we can support our children and caregivers, not just within our Peds care department, but also in our adult programs too. So just thinking about how we can support caregivers. So how many people in here have ever been a caregiver for somebody, right? And what we do know is it's exhausting. No matter, it can be rewarding at the same time, but it's also exhausting because it takes a lot out of us, mentally, physically, emotionally, right? So one of the big things that we can do is we can acknowledge and empathize with parents. So a lot of what we do is we just spend time being present with families, listening to their concerns, validating what they're doing. One of my favorite things to say to a lot of parents is you're doing a great job, and it's hard. Parenting is the hardest job in the world, and you're doing the best you can, and you're doing great. And then just checking in, and that's with our adult world too. So we need to check in with our caregivers just to say, okay, like, have we gotten any sleep? Are we eating? What are we doing to take care of ourselves? What are you doing that brings you joy in addition to caregiving? Okay.
I was just going to say, for the back to acknowledge and empathize with our adult caregivers, a lot of times they're taking care of their parents. So this may be a very unfamiliar role for them because you don't ever want to feel like you're mothering or fathering your mother or father because it seems disrespectful. But you have to care for them, and you have to guide them. And if they have dementia or they're a little forgetful, you have to maybe correct them, and that can be hard as the caregiver. So what you guys do and can do is really be that available space for them to share. I am just feeling, this feels wrong. And it's okay for them to say that. We've got to normalize, it's okay for them to maybe question their role because it's kind of switched from what they've known their whole life. This is my mother, or I've heard so many people say, my father was such a big man. And to see him now like he is, it's painful. So as volunteers, you are the perfect person to hear and for them to share those concerns, and you can really acknowledge how they're feeling. And how do you know, how does it feel when someone validates what you're saying? It feels like, oh my gosh, somebody hears me. I'm not crazy. And you guys have all of that power, and I can give reassurance to the caregivers.
And so listening actively, and don't feel like you need to give advice, because that's a big one, right? Because sometimes we have uncomfortable conversations with people, and we just want to like fix it and make people feel better. And sometimes that we inadvertently give advice to somebody and they may not receive that very well. So just knowing that being present and just listening, hearing them out, doesn't mean that you have to share with them unless you feel comfortable and that's something you want to do. But being present during visits. So that means it's really hard in the busy world that we live in, right? So we've probably got about 10 other things that we're responsible for at the same time that we're there visiting with a family. But kind of being able to set that on the back burner and just be present with them in that moment. For example, I don't keep my cell phone on when I'm in visits. I put it on mute, I vibrate it, I put it away, I don't bring it out unless I'm doing something with it with the family because I want to show them that I'm there and I'm listening. And then inviting them to events, even if they don't show up. So that's something that we do, like even with our bereaved families or our currently active families, I know that you've got a million things going on, you probably won't be able to make it, but I'm still gonna open up that door. It also goes along with like, families often ask, is it okay if I invite somebody still like to an event that I'm having or to birthday or celebration? Absolutely. You know, there's some normalcy in that, so it's important to continue to keep that for families that are maybe not available to go to the events or celebrations. Okay.
Yeah, I was saying something about listening actively because that's a learning, that's an art to do that, and it takes time to do it because I'm involved in placing calls, and you have to have full attention to the person. What happens is in your mind sometimes a thought or a question will come up, and so you'll deviate and really shut that. You have to shut that down.
Yeah.
Of course, as we get older, we don't remember to go back to it.
I have that problem now.
I got to do it too. But anyway, I think that's really important to give full attention to this. As I say, it's not easy.
Absolutely.
Especially if they trigger something in your mind.
Yeah.
So social work student here.
Yeah.
I got education on this one, but I will say the active listening piece might sound intimidating, but I found when you are actually like empathizing with the client, it's like kind of becomes natural in a way. I don't know if you had that experience, but it's like, you know, my internship last semester was at adolescent substance abuse. It's a population, and sometimes it's hard to actively listen because they're helping you, honestly. But then once you get in that space, that emotional space where you're feeling what they are feeling, it's like feels like the only thing that's happening. It's like you're doing that reflecting and active listening. So, you know, it sounds intimidating, but it can be a natural process.
Yep, absolutely. You're right.
I go to McGraw, and most of the time patients, you know, they're not awake, but I spend a lot of time talking to the caregivers, and once I ask them how you doing, which is like, yes, you know, you do. But then I always follow up, like, tell me about your family member. Because they want, you know, and I hear amazing stories about them. So it's just, let me know who you're here with. Is it your wife, your daughter, you know, whatever. And so it's diversion from staring at this person waiting for them to pass. It's been 15 or 20 minutes, like, oh, I was this bad teenager, but my mother loved me anyway. You know, I mean, just those stories that kind of like bubble up.
You're right. It's honoring somebody's loved one in their story, which is a beautiful thing. And I think that in those moments, it does. It is a distraction. It brings us back to the, you know, here and now and not focusing so much on what's going on.
And you're sitting there watching them for hours. You can just see.
And sometimes by sharing those memories or you're providing them space to share. I mean, not everyone is comfortable enough to sit there and speak with a patient that is not responding. But when they're sharing with you and you being that sounding board, they can essentially be sharing things. Maybe she wouldn't have told her parents or her loved one, I'm sorry for being a bad teenager.
But also it's a lot of just fun trivia, like one son, I learned all about the Pinkertons, you know, because you know, the train people, how they were the cops on the trains, and then they came in and established a town, and then I mean, it's like, it doesn't even have to be about that person. True. It's giving them a break.
Yep. Absolutely. And I really like how you talk about not remembering, but wanting to ask those questions. So anytime I go in for visits with families, I bring a notebook with me because my mind, I want to be focused on that person. I don't always remember things exactly. So during that conversation, and I let the family know ahead of time, like, you know, I'm going to bring a notebook because I have a hard time. So I'm remembering all the information you're giving me, and I need to write it down so I can remember. And I'll write down some of the questions that pop into my head, and then when it's the right time or when we finish with that, conversations I can go back and ask them. So a big thing working with, I've worked with families in the NICU getting ready to bring their babies home. And so one of the first things I say to the caregiver when I meet with them, tell me your story, tell me your journey. How did you get to where we are now? And I think it's very therapeutic and very healthy for the families to have that open, safe, I call it gracious space, to be able to process their thoughts and feelings on what they've experienced. So it's really helpful for the families when we do that.
But you're also asking open-ended questions.
Yep.
Staying away from the question that, like, how are you feeling? I'm okay.
Yeah.
Hasn't told me anything.
Yeah, exactly. Or I'll tell people, tell me more. Like,
Yeah.
how did that happen? Like, how did you deal with that? Like, that kind of thing. Yeah. So offering to help with something very specific is really good, because if I say, what do you need help with? We're asking somebody who's already got a lot going on in their world and can be feeling very overwhelmed to pinpoint what they need in that moment. And sometimes they're not able to tell you. So saying, can I help you with your dishes? Can I take a walk with you? Can I play a game with you? What can I do to help you? Yeah. And then, let's see, be an advocate for the caregiver. That's huge. Sometimes when caregivers are feeling overwhelmed, it's hard for them to put voice to what they're thinking, feeling, or what the questions they have. But sometimes what I'll do is I'll be like, remember when we're in a meeting or something, or we're meeting with a family, they were like, I don't have any questions. So I was like, remember when we talked about, you know, how you had questions about how home nursing works? And remember you had some questions about how the insurance covers it. And they're like, yeah, oh yeah, I have that. So advocating and facilitating those really effective communications is really, conversations is really important. And taking interest in, okay, so this is a little more towards children, but taking interest in the child, engaging with the child. So this is when we work with families who have medically complex children. A lot of times the families are like, some of our kids have like some physical deformities, or they have a lot of medical equipment. And so being able to communicate with that child, with that parent, right? And being able to engage with that child has that normalcy for the parent, and it's very comforting.
Yes. Even if you are volunteering with Peds Care, our department, and you're with one of these children, read to them, or maybe watch a show with them that looks like it interests them. You would be amazed at how relieved some caregivers are just to have their child being looked at, so they can maybe get up and go to the bathroom, or maybe they can take a shower. Because I don't know anyone that's had when you're a caregiver, you may start to neglect yourself just a little bit. So even if you can just be there with that patient, whether it be an adult or a child, and the caregiver can take a moment for themselves to take a shower, or make themselves a sandwich, or anything like that, that is a huge blessing to our caregivers.
And I think it goes with our adult population too, and the fact that when you come into a room, right, and there's a patient bed, whether they're alert or not, saying, you know, hello, Mr. Johnson, my name is Mackenzie, I'm here to sit with Carol for a while and talk with her, or, you know, just kind of still having that interaction. And remembering the person may not be awake, but is present in the room. So when we have those conversations, you know, not using like them, they, you know, kind of thing, because he's present. So making sure that patient, the family member feels that you understand that the patient is present. Let's see, and engaging the caregiver in a preferred activity. So maybe I have a caregiver that really likes to play Scrabble, right? And I know that, and that's their distraction. It brings their mind off, or they like to play card games or something. Doing something like that with them, it's okay. Doing a craft, right? Maybe they crochet and I crochet. So engaging in something that brings them joy along with them. And then the biggest thing in the world is show up, right? And that goes along with the being present, active listening, but also just showing up for those visits, right? That's huge. So if you have a family and they're expecting you can't be there, communicating that with them, right? I can't be there this week, I'm gonna be there next week. I just wanna make sure that you know. Okay. All right, so I love this. I use this with everybody everybody the oxygen mask theory. If you've ever been on an airplane, the one thing they'll tell you is that you put on your mask before you put on a child's mask, right? Because if I'm not breathing and I'm not okay, I cannot take care of that child or that adult. So self-care is huge for families, so we want to promote that. Has anybody heard of this kind of thing? Yeah, right? And there's a lot of truth to it. Okay, let's go to the next. So that's what we're going to talk about next is what is self-care. So a lot of people assume that self-care means I get up and I brush my teeth or I get up and take a shower. Yes, absolutely, that's a form of self-care. But also doing things that still bring you joy in life, right? So I'll give you a personal story. My stepfather had dementia, and in his last few days when he was in hospice, we were inpatient for about a week. And we spent a lot of time, it was during COVID, so it was just my mother and I that could be present in the room. So it's a lot of time there. And we would do things that bring us joy. We're both big readers. We would spend time reading, or we both like to play rummy, so we would play rummy and still do these things. And so even though there was only two of us in the room, there was a lot of laughter and joy in that area. Yeah. And that's one thing I ask is when I ask families, like what's your favorite activity or hobby? I don't. So what brings you joy? Right? What brings you happiness? And then we really encourage our families to engage in that.
So, quick, I have a personal story. So when I was a volunteer, I didn't have a caregiver present. Mine was an adult woman that lived by herself. She had lung cancer. So I was a young 30-year-old. I wasn't quite sure what being a volunteer looked like. So I showed up. And I tried to engage with her. Well, she loved watching, I think it was HSN. Oh, yeah. So I built a rapport there because I don't know much about HSN, but I love to shop. And before I knew it, a whole bunch of boxes started stacking up at the door. So she asked me to open her boxes for her because she was getting a little weaker, and it was around October, I think, October, November when I started. So she was buying Christmas presents. Well, to make sure the grandkids had what they needed and it worked appropriately, she wanted me to put these toys together and let's play with them. We had to try them out. Now, these were my memories with her, and it was something that she enjoyed. It may have been for the grandkids, but I secretly think she wanted to play with the toys, and that's fine. I put together a racetrack, and we played with race cars. It was what she enjoyed, and it's something I will never forget. I'm sure she would never forget. She really treasured our time together. So it may seem odd, but just something that they enjoy.
And when you think about that, sometimes people will be like, I can't think of anything. So that active listening comes in. Because sometimes we'll hear a parent like, I can't think of anything. But like, well, remember when you told me about how you really like to go on walks in the evening, and that's something that kind of calms you before you go to bed. Maybe that's something that you can do. So just really listening and kind of listening for those things that they enjoy, because they may not identify it as that moment. And taking care of your health. So what we know about caregivers is they tend to put off their own doctor's appointments. They tend to put off their own like medications and their own needs, right? They may not eat as healthy during those times. So the important thing is our mind and our body are connected. So if we're not taking care of our physical health, then that's going to start to weigh on us mentally too. So encouraging the caregivers to make sure that they're following up on their medical appointments, they're eating healthy, they're getting exercise, they're doing what they need to be physically healthy. And sometimes you have to say, well, you really want to be here for dad, or you really want to be here for your child, and if you're not taking care of yourself, it's really hard for you to really be there, right? And so sometimes that's what appeals to families, is connecting it back to their caregiving role. Oh, I'm sorry.
Oh, back.
Yep, sorry.
I don't know how to go back.
No.
It's not giving me a back option. I'm sorry.
Oh, that's okay. You are all good. I'll bring my notes. Nope, you're good. You're not worried. I remember what Ella said. All right, so giving yourself permission to take breaks is another one that we have. So if there's the opportunity for a respite, or whether it's from a family member or a formal organization, letting them know it is okay, or to tag in somebody, it is okay for you to allow yourself some breaks. Because it can wear on you being a caregiver, and if you're not getting breaks, then you're not taking care of yourself. So talking about that too. And then, so I like to call making self-care a mandatory. So just like, giving the medicine, maybe turning the person, maybe doing, for our kids, we do G-tube or trade changes. All those are mandatory, but also your self-care is mandatory. So I ask caregivers to do at least one non-negotiable a week. And what that is that no matter how hard you're struggling, no matter what you're going through or how much life is weighing on you, that's that one thing that you're going to do for yourself every day. And so I ask them to name that, right? It could be something as simple as I'm going to take a shower, or it could be I am going to cook myself one healthy meal, or I'm going to talk to a friend once a day. Whatever it is, that's that one non-negotiable that you'll do. Okay. And then, do you have anything else? Okay. So protective factors for caregivers. So social support is huge. It is so hard to do it on your own. It's the ability to talk about your problems, worries, and fears, right? So our ability to process what we're going through with people. And that may be a role of a volunteer who's present. And a lot of families don't have a lot of people in their world or in the area, so they don't get a lot of time to process that. So that's where a volunteer can come in and be a social support. And then increasing feelings of love, compassion, and decreasing feelings of isolation. Social support helps with all of that, so that you don't feel like you're going at it alone. That can also be somebody, I always say, who are your people? I don't always say who are your family, because not everybody has family. So I ask who are your people, and then I talk about different levels, right, of who your people could be. So maybe there's somebody that you do share all of these things with, your feelings, your worries, your fears, but then there's somebody that helps you when you need groceries, or there's somebody that helps you when you need to get, somebody to the car. So knowing who your people are, who can help you on different levels. And then coping skills, we do talk to families about coping skills, and some of those can just be the ability to talk to somebody. It can be your ability to engage in self-care, and taking those breaks. That's huge. That's a huge coping skill that we would encourage families to take. And let's see, your physical health, we talked about that, making sure you're getting the nutrition, exercise, and addressing health issues, and improving the ability to cope with stressors and be present when we do that. So that's the importance of the protective factors for them to have, is because that's how you can be present. So if you're worried about your health, you're worried about maybe not being able to go to work, you're worried about what's happening to your loved one, you've got all this stuff going on, it's really hard to be present if you're not able to manage those stressors. And so having protective factors like these help improve that. So that's where volunteers also come in, because of that social support piece. Okay. All right. Any questions about caregivers? Any comments before we move on to children? Please.
Concern. What if you notice that maybe the caregiver is overly stressed, maybe taking that stress out on the client? What do you do in that situation? That's like you said.
So I think
frustration, some fear, a lot of emotion.
Yeah. So I think if you're there's some concerns like that, I think your number one thing would be to, encourage them to share some of their concerns with the social worker that they're working with, and also you communicating back to the social worker, the team, because what may be going on is that they are struggling to manage, and they might need some more interventions. That hospice is very great in the fact that, each family has a social worker that can come in and provide that support for them. But active listening through those moments, hearing them out. When we validate the feelings, maybe not the behavior, because we don't want people to think, that, I'm yelling at my loved one all the time. But yeah, I hear you're frustrated, that this is a frustrating situation for you. Yeah.
I would definitely, for you as the volunteer in that situation, first of all, get calm and don't respond. Because I know some of us might get our heckles and be like, oh, hold up. but try to stay neutral. Of course, distract them. Hey, can I help you with something? You seem like you're overly stressed right now. Can we talk about that? That could be a distraction to get them away from the patient. But of course, we don't want them taking that out on you either as the volunteer. But maybe they just, I see you're having a lot of feelings. Can you tell me about that? Tell me how you're feeling. But as soon as you get out of that home, I would call your supervisor. You need to notify that team, especially if there's some physical stressors or physical things that are happening to the patient. That's never a good thing. But call your supervisor or reach out to your team and reach out to your team. Either one, both.
So I know in our Peds care, everybody gets assigned a buddy for each patient that they have. So we give them the contact information, name, it's usually our social worker who works directly with that family. So yes, communicating with your supervisor, but also like that team piece is huge. Yeah. Anybody else? Any other questions on the caregiver piece of it? All right. So talking about supporting children. So some variables to consider is, we talked about some of the physical piece. So some of the children, especially if you're working with children in Peds care, you may have some children with physical limitations, right? Or there may be some physical deformities kind of from like within the body. So with that being said, it's just, careful. They're very intuitive. So just you'll be careful about how you address things. And it's okay to ask questions. I think a lot of our kids that are verbal in our program, they're okay to ask, like, what happened? Can you tell me how you got here, kind of thing. Anything else? Psychological and emotional. So whether it's the adult population, there are children in the home. Just remember that it comes out differently a lot of times in children. So sadness can often look like anger. What we see as behaviors, right, is often a reaction. Every behavior serves a purpose. So it's usually a reaction to a feeling that they can't manage or don't understand. So just that's a big consideration when you're talking about whether it's somebody within our Peds care program or a child within the adult program. Cognitive, so their ability to understand. So we do have a lot of kids within our program that have like global developmental delay and cognitive delay, so there may be a certain level of understanding. So I may have a 15-year-old that understands about like at a 5-year-old age. So just understanding that and meeting them where they're at. So when we talk about when you're talking with a child, look at where they are developmentally versus what their chronological age are when you're talking to them and addressing issues.
And also thinking on that, if you're in the adult population and you're dealing with an able-bodied mind and child, remember that child is not, even if they're a teenager, they're not going to see things the way that we do. Their frontal lobe has not been formed, and while we can think rationally, this is what's happening, that child may not understand this is where we're going. So they may be rebellious. They may be acting out what she was talking about. And it's just, you would have to maybe show them a little grace. Because I know the inner mom in me wants to be like, what don't you act like that? But I have to show them some grace because they don't have my 40-year-old brain. They don't understand. It was so funny. It's my mother when I was young. She used to get so frustrated with me. She's like, I wish you could just understand. And then I remembered you did not have my 30-year-old brain. So we have to remember if you are a volunteer for the adult population and there may be teenagers or children in the house, understand that they're seeing things through pediatric or kid lenses, not necessarily how we think in our mind.
Yeah, and so what you want to also avoid is being ambiguous in your responses to children, because being age appropriate but also honest. So what's going on with Grandpa? Well, Grandpa's really sick. Being honest about that, because when you leave it open to interpretation, the kids may take it in a different direction, and it's hard to understand. Gray areas are difficult for children. Let's see, the social piece, so their world is likely changed, whether it be in the adult world, so think about it, now maybe we've got grandpa living with us, and mom and dad are taking shifts caring for him, and so maybe I've got, my uncle bringing me to all my football practices, or maybe mom and dad aren't making it to, my games and things like that. So it could look very different socially for that child, so taking that piece, and also just the social makeup of the family, right? Children don't live in silos, we live in a family system, so remember if mom and dad are struggling, most likely it's affecting the child. Whether it's, it's not deliberate, but it does happen, so, just remembering that there's a lot happening within that family and a lot more than what we can just see on the forefront. And then spiritual, so our families have different spiritual beliefs, so talking with your family, understanding what is okay to say, what is not okay to say, and just making sure that you're respecting what their wishes are when you're present with them. Yeah.
Different
Traditions,
cultures.
yeah. Okay, and then just the family system, just remember like I said, kids don't live in silos, they live in a system, so what we do to support the family, is definitely, and what is happening in the home is affecting that child too. Okay. So this is a little bit more specifically on children that we work with, so just remember there is a child maybe, what were they like prior to their illness, right? So some of our kids are in our program, not because they were born with issues, but then they may have developed cancer, or they may have developed another life-limiting disability. But sometimes kids struggle with, who was I before I was this? And sometimes, not intentionally, but will become the child's identity. So we try to, focus in. So that's having, those conversations is okay. Like, what did you used to enjoy? What has changed? What can you enjoy now? So we talk to families a lot about adapting to the new normal. Like, maybe we can't go and play baseball at this park, but guess what? We have an adaptive park that you could go to and play baseball at. Just kind of finding some kind of normalcy, just remembering that there was this whole world before this big shift and change for the entire family.
Now, do you have clients that, or whatever their chronic illnesses develop from birth, let's say, and there is no prior to? So you do have that?
Yep.
Okay, is it like more rare or something like that?
No.
Not really.
Okay.
It's half, it's kind of half and half.
Okay.
Yep.
It's, and another piece to that I would like to say is we had one child that was nonverbal. She could not speak whatsoever, and she was in the hospital for a while. And so the staff just kind of left her alone. She's clean, she's dry, she gets fed through a G-tube, no interaction. But that child understood everything that was going on around her. I'm going to flip that to an adult too. If you're with an adult and they can't verbalize, doesn't mean they don't understand everything going around them. So taking that into consideration too.
Yep. Exactly. So we have parents that'll say, hey, I'd like you to bring books to read to my child. And we might think to ourselves, they can't understand what we're saying. They're nonverbal, they don't interact, but they do. Kids, they can hear, a lot of our kids can understand, and our parents feel joy with that too. So I think if you're a volunteer and you're kind of thinking what am I doing here? Am I making a difference? Just know that, yes, you are. It just may not look the same as what you would if you had 10% able-bodied child. And then changes in the body. So just changes in the dynamics. Obviously, the medical pieces of that, with dealing with an illness, you may have been able to walk and now you can't, as the disease progresses.
Yeah. So everything, and this is, sorry, I'm going to take a side step. Everything I'm reading here, we're talking about children, but really it applies to adults as well. So I'm sorry, I'm going to back up just a minute. What was your life prior to your illness? That's huge. I mean, maybe they worked on the railroad and they want to talk about those days. Sometimes our patients remembering there was life before illness, that they had this big life and they achieved these great things. their body changes. I'm gonna link that in with the bottom. So I used to could do handiwork around the house. There's so much that I see that needs fixing, and now I can't do it. That is crumbling to the spirit. I used to could do these things, and now I can't. That would frustrate me. The same thing to a child. I used maybe they could walk, and now they can't because they have weakness. Well, that's disheartening. And having someone that can empathize and just listen is huge. So I think that is, yeah.
It kind of goes back to that thing, you don't have to give advice, right? Sometimes we don't need to say anything, right? It is okay just to listen and be okay with that silence, you know? So medications and their effect are most, so different.
Both sides.
Yeah.
I mean, the kids and the adults. They're taking all of these medications, and we had to add another medication to counteract the side effects from the first medication. And before you know it, I'm on 20 medications when all I had was heartburn. Well, good golly, I feel like a pharmacy now. So that's huge from kids and our adult population. And they may tell you, I'm just tired of taking pills. How many of you have heard that? Yeah, I'm just tired of taking medicines. So, and being able to verbalize that, knowing that you guys can't do a doggone thing about it, but just empathize and being like, yeah, that would be horrible. I'm so sorry you're having to go through that.
So the other piece is the changes, limitations versus normal level of growth and development. So with a lot of our kids, and even with, we talked a lot with our caregivers, is my other child, you know, at a year old was walking. My baby's not even crawling yet. My baby's not even rolling over. Like, so having a lot of those empathetic listening conversations with families, because it is a change in the development. It's not what was expected usually. But also, even with children, it gets frustrating, especially when you get around your peers and, you know, Sam's out there doing all the things and I can't go out and do that. And it gets very frustrating. So, anything that, you know, talking with them and then finding other ways. That's one thing that we do quite a bit within our Peds care program with our child life is we do adaptive play. So maybe you don't do it the same way Sam does it, but we'll figure out ways that you can do it too. So that could be something with the volunteers too that you guys can do. You know, maybe you can't go out and, you know, run the court and play basketball, but you can sit in the wheelchair and shoot hoops, you know, and just figuring out ways to help children. So I think also too, a big piece that people get really uncomfortable with, especially when we talk about children, is like disease progression and when that sometimes decisions are made to no longer seek curative treatment, right? So you may be working with a family that has came to that decision in their world, so there may be a child with cancer that's no longer getting radiation or chemo or any kind of treatment for that. And so a lot of times families and the children themselves are processing that. And sometimes they want to talk about that, what they think and feel about, like Tamara was saying, you know, I was on all these medications and now I'm just not. And this is what's happening within my body. All these changes are occurring now. So just being there, being present and listening, it can be very uncomfortable. So I want to validate that, especially when we talk about in the adolescent and child population, because, you know, there's an expectation that children are supposed to live longer than adults or their parents and stuff. And when that's challenged based on that belief or, you know, thought is challenged based on a child's situation, it can be very uncomfortable. So if you're in a situation like that and a child is, you know, processing with you, being present, listening is the best thing. And if you need to process that with your supervisor or, you know, your team. So just the social development. So we do a lot within our program about normalcy and social interactions. We try to really encourage them. So if you've ever been to any of our events, you'll see that whether it be like the Easter event or we're getting ready to do a movie matinee day with families. So some children that maybe have all this equipment can't go to a, you know, theater is going to come and be able to have that theater experience with us. And so we try to definitely normalize that. So going in, doing those activities, doing the play with them, it is so valuable to the kids. And a lot of our kids find themselves isolated at home because of their medical complexities. So, and with that being said, it's the same thing on the adult side. If there's a child or sibling or somebody in the house, doing those normal interactions to help develop that social development.
And I'm gonna kind of put a plug in here for Peds Care. That's why I crossed over to Peds Care. We get to have so much fun. So if you ever get a chance to come to one of our Peds Care events, our whole identity is we make a community for our families, for the patients and the caregivers, the siblings, the whole family unit, because they need a place where the patient can feel normal. And I think that's a beautiful thing.
We have to do more volunteer training to just help out with one of your events.
I don't think so.
No, it's only if you're gonna be like assigned, right?
Going into a
I
home.
wanted to make sure. that-
Yeah.
So we get to have all the parties.
That's my favorite thing. Just seeing the joy on the kids' face. So let me give you an example of how we try to meet the kids' needs. So if you've ever been to the Easter event that the volunteers put on, we spend hours and hours and hours tying eggs to helium balloons so that our kids that are in wheelchairs or can't bend over and pick up the eggs during the hunt are able to do the Easter egg hunt along with everybody else.
Yeah, and then we have, in springtime, we have a day out at Diamond D where our kids can go and ride ponies. They can go on hay rides, and I mean, the Diamond D people literally pick wheelchairing up all and put them on these huge trailers so these kids can ride around and see animals, and they get to just be a kid. They get to do catch and release fishing.
Yeah.
I mean, this is something that they may not normally be able to do without modifications. So having that socialization and that sense of community is huge. And that's really what Peds Care is just make it. And I don't know who has been to Hadlow and can't walk in the front door. That is gonna be the new Peds Care Center. So it's coming to where we will have events right there in the center of Hadlow and have bereavement groups and just support groups for families for caregivers and the kids, and all of this going right there on the Hadlow campus.
All right.
Sorry.
Well, no. So psychological development for emotional coping skills. So, and then who were we prior to the illness? All of this is stuff that kids they want to talk about it. I like to say that gracious space because it's a place that you can just say all the things. You can get it out, able to process. But a lot of our kids like to talk about who I was prior and what does my world look like now, right? The world changes. Our family dynamics change. Our friendships sometimes change, so being able to give them some space to process that and talk about it. And then what strengths can we draw on? So we're all about the strengths, right? So what is working, what is going good, and how can we support you in that? And as in volunteers, like we've got this one kiddo that just loves to walk. And we've got a volunteer that will go I think once a week, and walk this kiddo up and down these hills in his neighborhood, and it just brings so much joy. And the strength is, that's something that we can support joy in, right? That's the big piece is we're helping these kids find that joy to kind of find that balance between where my world is now, where it was, and where it may be going. Okay. Yep. So we don't always want to focus in on the illness piece too. We want to focus in on what brings joy. Okay. So the cognitive development, we talked about this a little bit before, but just thinking about what do they understand, what can they sense and observe? Kids are intuitive. Mom's feeling sad, they know it, right? So don't try to talk around it. Being honest and age appropriate is really the best way to address it. Are they commonly aware of the brevity of the time they have left? So that's for our kids that are in our program and their diseases are progressing. They are very usually well aware of where their disease is progressing towards. So trying to maybe say, oh, we've got all this time to do it, that becomes that ambiguous answer, and it becomes very confusing for children, especially children who are very aware of how their disease is progressing. All right.
I'm not doing it till you tell me anymore.
Sorry. Sorry, I think you can read my mind, you know. And then don't underestimate a child's capacity to understand. So they're going to cope with what they know. So if we're not telling them things, then we're not giving them the ability to cope. I will say there is a caveat there. Sometimes families will not want you to talk with kids about it. So we do respect the family's wishes on that. So just kind of keep that in mind if you're working with some children, even whether it's in the adult world or the child world. If the family has expressed we don't want them to know, we do honor that wish. The team will discuss some of those with the family though. They can't cope, of course, with what they don't know. But we want children to have an atmosphere that is open, so we do advocate that with our families. And it's critical to follow the child's lead. So when you're visiting a child, if they're like, you know, today's just not that day. Maybe I don't want to go out and have that walk. Okay, well maybe we can stay inside and color. Or maybe we can stay inside and play a video game. Or we can do something else, but be okay with those changes. And then always listening, and when you don't know, and that is okay. I don't know is an okay answer. We don't want to tell kids things that are untrue, or even if they're not, it's not done intentionally. Okay. So what can I say? Use open-ended questions. You mentioned that earlier.
Yeah.
That don't have the fixed answers, to ask about your feelings, your memories, your personal experiences, and your interpretations. So it's okay to ask questions. It is okay to open up and have discussions. I think the memories and the feelings and the personal experiences are huge because kids want to talk about it, right? How was your day at school? What did you do today at school, right? We always ask kids, did you have fun? What was your favorite thing about today at this event? So reflecting, what you hear, what you see. So we talked a little bit about that with caregivers. So we do that with our kids. Like, I don't like to do anything. Really? Because when we talked earlier, you told me that you really like to color. Can we try that? Or you really like to play cards? Maybe we could do that. So showing them that you're listening. What their experiences is, validating them, and just letting them know they are seen and heard. That's huge for kids just as much as it is caregivers. They don't have a lot of choice in their world as children. And then especially when you're talking about children with different life-limiting diseases and illnesses. They didn't choose this, right? A lot of times you go in the doctor and they choose, or your parent chooses what you're doing as the next steps. So letting them know that they're heard and seen is super important. So just a little bit on the rules. This is piece care specific, but these are different things that you can do with children, but I think a lot of this does apply to the adult world too.
Hey, anybody that can do yoga, let me know. I can't even do that. I might employ you to come to the center, teach a class.
Yes. But tutoring, you can play games during the visits. We have some families, kiddos that love to bake and cook. So going in and doing some baking and cooking with them.
I have a volunteer that does that. She
Yeah.
goes in and makes different meals and.
Yeah, totally enjoy that. But anything that you can find that you can help, these can apply to the adult world too. But if you want to know about ways to volunteer within Peds care, if you're not doing directly with the kids, we do have opportunities to make calls and do filings and things like that within our office too. Okay. So special activities. The play is huge. Play is children's work, right? So anytime you can go in and play with a child, read a book, go on a walk, play a video game, color, I mean, just whatever the child, play Barbies, we do it all. Different creative activities that you can do with kids. Memory making is huge. Reading, the expressive activities, motor activities, any kind of like make-believe is huge for kids too. So just as some other opportunities to do some volunteer work, I can do one of those.
Yeah.
So different things that you can do with families. So one of the beautiful things there was the volunteers that do, they make the pillows for families out of clothing from the kids. Our families love those. Blankets, I worked with babies before I came into my new role, and so some of the volunteers make the best blankets to put on the floor for tummy time and learning to crawl. So it's very beautiful, and the memory making piece is huge for families. That's honoring, and they hold on to those memory making tools and the different items that are helpmates. So that's something that you can assist with too. We have child life in our department and in the adult department. So if you're ever working with children and you have a child life person, you can talk with them about, hey, what can we do? We need to team up and do it. Some memory making with them.